Hey y'all. Okay, so I want to talk to you um, about this whole ehrlichiosis debacle. Okay, and I'm gonna keep my peepers on because I need to use them to read and all this other good stuff. So the reason why I'm going in more detail about this and talking about it again is because it's so serious and because if untreated, the person can die. And my friend went through this. He was close to no longer being on this planet. And so it was very, very serious. I think that he's still in denial about how serious this was. So he got bit by a tick. One of the ticks, there's two types of ticks that cause this bacteria. The bacteria is called Ehrlichia. And there's a brown tick that has like a beige spot on the top of its body. That tick and the black-legged tick are the ones that can transmit Ehrlichia, which causes ehrlichiosis, which is a bacterial infection. If not treated, like I said, it'll kill the person. So what happened was my friend went to the hospital in Illinois, and I guess he hates being in the hospital, which is fine, but don't do anything rash because you could put your own life in jeopardy. So they couldn't figure out what was wrong with him, so he decided to check himself out of the hospital. This illness is very hard to detect, so they couldn't figure it out. They said, well, you're having issues with your liver. But another doctor, well, we'll get to that in a second. But they couldn't figure it out at the hospital he was at in Illinois. So he ended up coming back here, and I guess it was 3 or 4 days, might have been, yeah, 3 or 4 days where he got worse. And he basically said he took this huge utility fan and he brought it in his room, and his fever was out of control at this point. He's getting worse and worse and worse. And so I basically was at the dog park with Milo, and he texted me and said, I need to go to the ER. When he put this huge utility fan in his room, without even stopping myself, I said, that's not going to help because the fever is deep within your body. And it didn't help him. So I was at the dog park, and he texted me. This is 3 or 4 days after he checked himself out of the original hospital. And then he said he had to go to the ER here. So we're going to make another trip. Well, my first trip, his second trip to the ER. And the doctor said, one of the doctors was hip to what's going on with him. The other doctor wasn't. He said, well, the first doctor said, he came in the room, he looked at all the symptoms, and he said, he came back in the room and he goes, are you having headaches? He goes, yeah. He goes, and they walked out of the room, because that kind of confirmed what he thought it was. So he thought it was ehrlichiosis, and the other doctor was like, it's something with his liver. Well, it's not his liver. He does have an issue with his liver, but there was something more going on. So his symptoms were extreme. He had pain in his body. His back caused him severe pain. He was beyond exhausted. Exhausted doesn't even scratch the surface. He kept complaining about his back. His back was getting worse and worse and worse and worse. His kidneys were shutting down. His blood pressure was dangerously low. The nurse told me, if we have to give him a medicine to increase his blood pressure, we're going to have to put him in the ICU. He also had abdominal pain, and he also had I'm thinking. Severe acid reflux. Because at this point, he is in septic shock. When your blood pressure bottoms out and just keeps bottoming out lower and lower and lower, that's a sign of sepsis, which is a sign of septic shock. So this bacteria was trying to, it basically disorganizes your organs, okay? If this goes untreated, all right? If you get treated right away, you're going to be okay. If they can detect what's wrong with you. So he just got worse and worse. And I said, I think your kidneys are shutting down. That's why your pain in your back is so bad. They had to give him 2 bags of IV fluids because the nurse was telling him that your heart cannot function if it doesn't have enough fluid to function with. So they gave him 2 bags of IVs. His white blood cells were extremely low, which is that's the army for your body to fight against illness. So he was basically on his way out of here. He was this close to the to the ICU, and he was just getting worse and worse and worse and worse. Okay, so according to the Cleveland Clinic, and I'll just kind of go over, give you a general idea of what this illness is. It is called ehrlich, ehrlichiosis, ehrlichiosis. Some people online were saying it's how are they saying it? Ehrlichiosis. That is not the proper that is not the proper pronunciation. It is ehrlichiosis, okay? It is called by the bacteria Ehrlichia schaffinensis, whatever words, okay? Long words. You can get ehrlichiosis through the bite of infected ticks, including the Lone Star tick and the black-legged tick. The Lone Star one is the brown that I described to you that has the beige on top of its body. Symptoms can start out mild and flu-like, but if not treated quickly, ehrlichiosis can be life-threatening. Ehrlichiosis is sometimes called human monocytic ehrlichiosis. You can get ehrlichiosis and Lyme disease from tick bites, but they can cause different symptoms. Ehrlichiosis can cause the life-threatening illness if not treated right away. I still think he's in denial about how serious and how gravely ill he was. I think I don't think that fully grabs his mind. An infection with Ehrlichia bacteria can be serious if not treated. Nearly 60% of people with ehrlichiosis are hospitalized. It's estimated that 1% of cases are fatal. Again, if you don't get treated, you're not going to survive it. It's just that simple. All right? Ehrlichiosis can affect anyone who's bitten by a tick. Ticks usually live in tall grass and in wooded areas. Your pets can also carry them. I check Milo every single day for them, every day. There's no day that I don't check, and he is on medication, and it doesn't matter. They're so horrific this year that they're out of control. Okay, so certain people are more at risk than others. People who are older than 50, people who are living with compromised immune system, HIV, cancer, or medications, living with chronic illness like diabetes or connective tissue disorders. It's mostly found in the Midwest. We're in Missouri. South, Central, and Eastern regions. It's also found in other areas around the world. Okay. It's still pretty uncommon. Cases have gone up from 200 cases per year in 2000 to over 2,000 cases in 2019. You're more likely to get ehrlichiosis in the early summer months, May to July, or in September. Ticks are common during the summer when people are outdoors a lot. He also, I don't know if I told you this, but he also had I did tell you that it was also destroying his white blood cell count. Ehrlichia, the bacteria that causes ehrlichiosis, gets into your bloodstream from the bite of the tick. It infects and eventually destroys your white blood cells, an important part of your immune system. What are the symptoms? fever, chills. He had all of these symptoms. Fever, chills, headache, muscle pain or soreness, tiredness. He wasn't tired, honey. No baby, no baby, no baby. He was exhausted. Okay? Tired doesn't even scratch the surface. A few days later, you may get additional symptoms. Rash, can be splotchy red patches or pinpoint dots. Cough, nausea and vomiting, stomach pain and confusion. So it's caused by, like I said, caused by a bacteria. How is it spread? It's spread through tick bites. The most common carriers are, like I said, the lone tick and the black-legged tick. Tick bites infect animals like deer, dogs, or coyotes and then bite you. This spreads the bacteria to your body. In rare cases, you can get it from a blood transfusion or organ transplant, and those situations are rare for you to get it in those circumstances. It doesn't spread from person to person. You will be given, in order to be diagnosed, you will be given a physical exam and asked about your symptoms and health history. It's important for them to know if you've recently, within the past 3 weeks, been in an area where you could have been bitten by a tick, even if you don't remember being bitten. They'll use this information and blood tests to decide whether you should be treated for ehrlichiosis. What tests will be done? Blood tests. They're going to look for signs of the bacteria. They'll try to get the bacteria to grow. So they did give him a blood culture, but it takes time for it to grow. In the meantime, it could take weeks to get the results back because they have to have, it's a blood culture, and they have to have the bacteria basically start to spread in the blood, and it takes a while to do that. In the meantime, that person, because as bad as he was, he would not have survived waiting weeks because he was bottoming out, okay? It's treated with antibiotics. He was given doxycycline for it. Here's the thing, okay? This is the most important thing to remember. I've said this before, and I'm going to say it again. If you are on an antibiotic, you take every single pill to the end. Because with this particular illness, and in general, okay, but with this particular illness, if you decide that you won't just stop taking your antibiotics because I feel better now, you don't want to do that. You know why? I'll tell you why. Because you will cause yourself worse problems. You're not gonna make it. This is what happens when you have this condition and you stop taking your medicine. You will you stop taking them, you forgot to take them for a couple of days, for example, or you just quit taking them. The bacteria comes back worse, and it comes back immune to the antibiotic. Okay? Immune to the antibiotic, which means you are up shit's creek without a paddle, which he already was in that situation. Okay? How soon will you feel better? Antibiotics you should feel better within 24 to 48 hours. Continue taking antibiotics for as long as your provider prescribes, even after you feel better. If you don't start feeling better within a few days, contact your provider. How can I reduce my risk of, contracting this bacteria? Keep grass shorter than 5 inches. Stay on cleared path when in wooded areas. Use bug spray with DEET or other ingredients approved to keep ticks away. Be careful with DEET because it can eat through plastic. So if you're hiking or whatever it is that you're doing, and you have things that are made of plastic, DEET can destroy those items. So be very careful with DEET. Use clothing to cover as much of your skin as possible when you're in the woods or areas with long grass. You can buy special tick repellent clothing if you're often in areas with ticks. Check yourself for ticks after you've been outside. If possible, have someone else check you in places you can't see yourself, like your back and your scalp. Ask your veterinarian about the best way to protect your pet from ticks. Check your pets for ticks often, especially after they've been outside. Follow directions for safely removing a tick if you find one on you. So this is what I used. My dog had one on him today. I showed you this before. It's called Ticked Off. 3 came in a package. And because you see the little notch in there, okay? So it goes, you kind of scoop it under the tick, and you just scoop it, and it takes it right off. That sucker has a death grip on it. Whatever it's holding on to, it has a death grip. This is unfazed by that. It will get that sucker right off of there, okay? It's called Ticked Off, and 3 came in a package. And I like that it's a bright color because it's easy to find. In fact, I used it today because Milo, my dog, had one on him today, and he's on medication, and it didn't matter. And I'm like, yeah, we're not playing that game, okay? We just not doing that. You can have life-threatening complications, disseminated intravascular coagulation, acute respiratory distress syndrome, renal failure. Remember I told you his kidneys were shutting down, that's why his back was killing him? There you go. Internal bleeding, which is called hemorrhaging, sepsis, which is where he was, brain inflammation, heart failure, seizures, or coma. This will happen or can happen if you don't get treated, okay? The outlook is good if treated quickly. People who start antibiotics soon after their symptoms appear usually don't have serious complications. Does it ever go away? It can go away with treatment, but it can take a few weeks after finishing medicine to feel better completely. It can be fatal if you have serious complications. The death rate for ehrlichiosis is 1%. Take all your medicine. This is when you should go to the ER. Fever over 103, coughing up blood, severe shortness of breath, confusion or other mental changes, severe stomach, abdominal pain, and seizures. So, this is from the Cleveland Clinic. It's going to be backwards, but anyway. Cleveland Clinic ehrlichiosis. All right, so you can just put that in there in your search. So don't take it lightly, okay? It's nothing to play with. I mean, it is getting inside your body, and it's basically trying to erase you. All right, it's trying to erase you. It's trying to get you right off the planet. So you have to have your army, and your army is going to be, the reason he went to the hospital is because the second time, okay? First time was exhaustion, just fever and exhaustion. And then the second time was because the exhaustion was worse. He was having acid reflux. He doesn't ever have that. Severe exhaustion, severe fever, pain in his body, being disoriented, and could not get the fever under control, right? Because you have to have medication. You have to be on medication, provided your doctor can figure out what's going on with you. You know what I mean? So take this seriously. Spray your body with Permethrin, and spray your skin with Deep Woods Off, or just off, period. Ticks are attracted to your natural smell. Those sprays cover up your natural smell, so it's a barrier. Like, get out of here, okay? Take it seriously. You don't want to die, or someone else to die, someone close to you to die because they were lackadaisical. This is nothing to play with, okay? You guys take care. Much love. Bye-bye.